The early indications we have is that it may be more transmissible than the Delta variant, and the vaccines that we currently have may be less effective against it.
Alarm from the UK government, ramping up restrictions quickly, all because of this COVID variant B11529. So far, only 27 cases in 3 countries have been confirmed. This new form of the virus will likely be named New. It has a massive 32 mutations in the spike proteins. Most of our current vaccines use to teach our immune systems to identify and attack the disease.
The fear about the 32 mutations is that the vaccines that have been developed and used in Australia and around the world mostly, is that it's about priming our immune response to recognise the spike. But if the spike has changed, then the vaccine efficacy drops dramatically.
Researchers believe a variant with such a large number of mutations was likely to only occur in a person with a compromised immune system, possibly an untreated HIV/AIDS patient in Africa. Around the world, scientists are stepping up surveillance, closely monitoring numbers of cases and their locations. But it's not a variant of concern yet.
Sometimes we might see an increase, say, in ability to escape the vaccine, but a reduction in ability to transmit, for example. So we might see some concerning mutations in regions that make us worried about the vaccines or therapies. If it's not a highly infectious strain or one that's, perhaps doesn't cause a severe disease, then maybe it won't be something that's as big a concern as we first thought.
We monitor all of these variants. And we note the responses that are made by other countries, and we consider those in real time.
Whatever becomes of the new variant, it's clear that even though life is getting back to normal in Australia, COVID still has curveballs to throw our way.
We're going to keep needing to use boosters to our advantage. We're going to keep needing to get access to new therapies. We're going to keep needing to test when people have symptoms or are concerned they're infected. And we are going to still need some public health measures, hopefully in the background largely, moving forward. And so, we do need to keep on our toes and not get complacent, because this virus will keep coming for some time.
I tell you what, the 2 worst phrases together are new variant and worst one yet.
This is true, but remember, we do have a booster shot program ready to roll out. People are already getting their 3rd shots, booster shots. I know they're saying there's questions about the transmissibility and the ability of the vaccines we have to respond to this, but the transmissibility is the key factor, right? If we can get enough people with their boosters, we will stand a good chance of dealing with this in a way that we weren't able to before.
I think when news like this comes out, my heart really goes out to all those people trying to get home from different places around the world, because the first thing they do is stop travel. And after such a long period of time with people having these restrictions and feeling like things are going to open up, it's just a terrifying thought that we're going back into something.
A lot of sympathy for them. Also for Mary Louise McLaws. I thought she was going to get a break over summer.
I love your pragmatism. I love your empathy. I'm just going to pretend that I didn't hear any of that and put my head in the sand. That is my
I can't
strategy.
hear what you guys are talking about. What? I have no idea what you're talking about.
Nothing, exactly. Don't worry about it, Nads. Enjoy your pub, mate. All good.